Thank you, Mr. Chair. Before I ask the questions, I would like to take a moment to express my disappointment with how the markup went, or should I say more accurately, did not go, yesterday. I have worked with my colleague, Senator Klobuchar, on my Rural Broadband Protection Act beginning last Congress. It's a common sense bill that will help USF high-cost projects across our country. It's been sitting in this committee since the beginning of this Congress, and after working to improve the bill, my substitute amendment was cleared to be marked up both by the majority and the minority back in November. I urge the chair, through you, to schedule a legislative markup this work period so that my top broadband policy priority can be considered. I would appreciate you. We'll talk to the chair and ranking member about that. So moving to my questions, Ms. DeWitt, I know that many states, and I think you've gone through this, and I caught the tail end of you mentioning it to Senator Peters. West Virginia was the second state that actually got their Part 2 BEAD plan okayed, and we're very excited about that. But can you describe the impact on BEAD programs? Because we have part of the Affordable Connectivity Plan as part of our deployment plan, how this will affect if the ACP does not get funded.
Yes, and thank you for the question, Senator Capito, and for your ongoing work to continue supporting the program, including for robust discussions about potential reforms. Right now, let me just draw attention to the current costs per passing that were shared from West Virginia's capital projects funds, and that's $4,200 per location. What research from the Boston Consulting Group has found that without the BEAD subsidy, we will see a $500 per location differential on
without the ECP.
Sorry, yes, without ECP. Sorry, excuse me. So the Boston Consulting Group study found that without ACP, the cost per passing may increase by $500 per location. So what we can assume from this is that the cost for deployment in West Virginia will increase without ACP available.
Does the is that, would you say 4,200?
Yes, ma'am. But that's with the Capital Projects Fund. What the state has spent, then that includes significant matching funds from internet service providers as well. So.
Right. Now, I've been told, and I can see, living in such a beautiful state, which lovely mountains, but hard rocks in between, that the cost to build in our state, obviously for fiber, is much greater. How does that 4,200 stack up? I'm just curious to know. Is that high? Is high cost?
I would need to get back to you
okay.
to quote the specific numbers, but yes, that is, the numbers are high, and of course the cost per location passing is going to depend on a number of factors, including the topography, as we're
right.
all familiar with West Virginia, but
right.
also density of population. Yeah.
Okay, Dr. Winfried, I've been alluded to as the one who wants to be the reformer, and I couldn't be more passionate about this. I mean, I think it was earlier this week, the president of a local internet service provider said that he was informed that he's eligible for the $30 a month because of the way it's the school lunch program in our state makes everybody eligible. I mean, it cannot possibly be true. The 23 million people really need this. We've got to narrow it down to the need. I'm supportive of the program. Could you respond to that?
I think that's exactly right. I mean, as I mentioned earlier, ACP is fundamentally not a program for rural areas. It is a program for urban areas. Most ACP recipients live in urban areas, even after you adjust for the fact that most people live in urban areas. And the challenges that people have in both urban versus rural areas are very different, as you are an expert on representing the great state of West Virginia. That said, like other government programs as well. I mean, I referenced in my responses to Senator Cruz, we had a similar challenge with the Affordable Care Act. There are premium tax credits that people get to help them afford private health insurance. And we learned very quickly that there were millionaires who were receiving those premium tax credits right. for lots of different reasons. So there needs to be a reconciliation process to make sure that the funds are targeted in the best way, and that there's an urban versus rural adjustment.
Well, yeah, I would be interested in the urban and rural adjustment. I just think that I understand the urgency and the expiration, and instead of $30, I understand it's $14. I don't know how long that's going to last. Does anybody know what the long? Yes. 1 month. So, you know, ostensibly not long at all. We've known this was coming. We've been talking about reform for a year. I don't know why we have to be pressed now to move forward to a way over expansive program that is being is going towards some people that don't need it. So because it's not fair to the people that do need it, because it calls into question what's going to happen with the entire program. So I would ask my colleagues to listen to experts on the panel here to figure out a way that we can do both of these things. And I think we can and meet the challenges. Obviously, I'm in a state that has economic challenges. We have some of the lowest broadband deployment in the entire country. You know, and I think it's the digital divide. You can see it all over our state with economic development, education progress, health care outcomes. And so I am very passionate about getting to the last house and to make sure that everybody has equal access, but that they can afford it at the same time. So I thank you all for what you're doing, and I appreciate, Mr. Chairman, the chance to address the panel. Thank you.